Here's your data update for Phase 1C Week 2. As of April 6th, over 1.4 million doses have been administered at Chicago sites, with 31% given to non-Chicagoans. 1.3 million doses have been given to Chicago residents, with 23% given outside of Chicago. In total, 1 in 3 Chicagoans have received a first dose of vaccine, 4 in 10 Chicagoans 18 plus, and 6 in 10 Chicagoans 65 plus have received a first dose. Remember that nationwide, 75% of 65 plus population have received at least one dose, so we are still lagging in coverage of our most vulnerable residents. As of April 6th, the 7-day rolling average of all doses given was 25,220 doses per day, and plateauing since last week, with a shift to more second doses. You can see that here broken down by race ethnicity. You can see that the 7-day rolling average of first doses has been declining since last week, 16,416 doses a day, down from a peak of 17,806 doses a day. And the 7-day rolling average of completed vaccine series at the highest level yet, 10,689 completed series per day. Equity has been decreasing since the transition to Phase 1C. In the first week of 1C, only 39% of first doses went to Latinx and Black non-Latinx Chicagoans, though our goal is 59%, proportionate to Chicago's background demographics. Community areas with the largest increase in first dose coverage last week were on the north side of the city, where low CCVI community areas exist. Other trends among pharmacies and outpatient providers are unchanged from the prior week. Many of you have been frustrated with a lack of information on how many doses to expect per week. This week, we received notification about our next 3 weeks of allocation, and it appears that CDPH's allocation of Moderna and Pfizer vaccine will not increase. Meanwhile, the federal pharmacy and FQHC programs will continue to expand. It is a priority of the CDC for jurisdictions to make efforts to spread doses out to more providers, especially in areas of high community vulnerability and low vaccine uptake. As we have said previously, primary care providers play an influential role in building confidence in and improving access to vaccines. However, nationally, less than 5% of all COVID-19 vaccine doses have been administered by primary care providers, and that number is about 10% in the city of Chicago. We will continue to keep you updated on expected allocation and changes to federal programs as we receive them. See you next week.